May 6th, 2014, I had found a lump under my arm when I was shaving. And I noticed that I had a big lump under my left arm. And then when I shaved on my right side, I was like, they're not the same. And so I started feeling around and I found a knot under my arm. So I went to my family doctor and she said there's definitely something there. Let's run a full range blood test. So she ran the blood test, came back all normal, so I thought, oh great, you know, it's probably just an infection. And so she said, well, let's go do a mammogram, ultrasound. They did a couple of mammograms. Even the technician said they came back clear. She didn't see anything. But the doctor came in, and when they were doing the ultrasound under the arm, and he said, I want to do another one that's blown up. Just to look, there's just a spot. And so they did that. And they took me into a room and had my films up on the wall. And he said, you see this? You have breast cancer. And I just remember, I just started shaking my head no and looking at him and no. And I don't remember a lot of what he said after that point. It just, everything stopped. And he said, I will schedule you for biopsies. So 2 days later, we went in and I had 3 biopsies done. And that Monday after Mother's Day, he called me at 9 o'clock in the morning and said I had infiltrative ductal carcinoma. And that he thought it was very aggressive and that I needed to do something immediately and not let time wait. So I did. Through a series of events, I ended up going to OU Medical, and they diagnosed it as triple negative, which is a rare type cancer. It was also extremely aggressive. Most cancers take, it's like 10% of the cells will reproduce, and they take about 2 weeks. Mine was rapidly producing. 98% of my cancer was rapidly reproducing. And so in the matter of a couple of weeks, it had gone from a spot to a 7 centimeter, 5 centimeter, and 3 centimeter. And because of that, I had to go into adjuvant therapy, chemotherapy, very aggressive. So I did chemotherapy, and then they did the left mastectomy. I didn't think that I could deal with having no breast at that time. And because they kept telling me that I would have to wait 6 months after my radiation, because I was going to also have to have 6.5 weeks of daily radiation. And I thought, I can't go 6 months without a breast. I mean, I'm losing my hair. I still get upset about that. Well, we get through it. You get through it. And that's the thing. I don't think that people who have not been diagnosed, I'll get myself together. People who have not been diagnosed with cancer, they have a textbook understanding of it. You know that people, you know what women go through. But when it comes to your doorstep, it's a whole different, ballgame. And all of a sudden, it's an emotional battle as much as it is a physical battle. You have to steel yourself to fight that battle, to win. But you also have to find a way to build yourself back as a woman. So, they told me that I wouldn't be able to have reconstructive for 6 months. And I thought, I can't go that long. I just don't know that I can go that long. I just don't know that I can go through chemotherapy, radiation, and all that, and then 6 months later, and then have to go through all of the steps for reconstruction. That's a long That's a long time. And so I started my chemotherapy. October 1st was the mastectomy for my left side. The surgeon came in and she said, look, we're going to only do the left side. I think they knew that emotionally I just could not deal with both breasts being gone. We only care about the left, so we're going to do the left. We'll leave the right for now, and then you can have that done when you do reconstruction. I said, okay. So they did the mastectomy. And I remember asking, can I keep my nipple? Can I have skin sparing? Can I do this? And even though she's a great surgeon, she said, well, you know, really, they'll probably prefer for you not to have that because it may not be in the right spot, or just the effects of radiation. And I thought, okay, I can't keep anything. So they took it all off. I wish I had known about PRMA and Dr. C at that time. I would have come down here and had him do my mastectomy and gone a little different route. I think that there is something to be said when you get to keep your nipple. It's a small thing. Even though through a mastectomy you lose some sensation, there's still that little piece of being a woman, and part of that is you want to keep any part of yourself that you can prior to cancer. And as small as it sounds, keeping that nipple sometimes is just really important. Or having your own skin. And so I did the mastectomy, and I remember looking in the mirror thinking, and it was easier to look at my breast being gone than it was my hair being gone, believe it or not. And I thought, okay, all right, well, we're just going to have to move forward. We're just going to have to deal with it. So I go through the radiation, and during that time, I started looking for reconstruction. I was under the impression that I could do the most common, which is the implants and expanders. But because I had had such severe radiation, I was not a candidate for that. And so I was told I would have to do that DIEP flap, and I'd never heard of that. And I was like, what is a DIEP flap? Started searching the internet and looking at surgeons that were there in my home state. And I thought, is this as good as it gets? You mean I'm going through chemotherapy, I'm losing myself, I've lost my hair, my health is going down, I'm fighting cancer, and this is the best that I can hope for coming out on the other side? They just didn't specialize in doing this type of flap, and there wasn't the symmetry, there wasn't, it was more like a jigsaw puzzle being put together. And I kept searching, thinking, certainly somebody has got to really excel at doing this. And I came across PRMA. And when I looked at the website, I looked at the photographs and I thought, holy crikey, somebody knows what they're doing. This is, okay, I can live with this. This is, some of these look pretty daggum good. And I deserve this. I've been through a lot. I deserve to look this good. You're not perfect, but you're pretty darn close. And then as I started looking through the website, I realized that this wasn't just coming in, having your breast rebuilt, but that the office also cared and understood the emotional side of cancer and what women go through. So I made the call, talked with you, and have not regretted it since then. I came in on February 28th and had my first procedure. I will say that when you wake up, it is, you're not in pain, but it is a little startling what they do to you. Is it anything that you can't overcome? No. No. But you do look down and you're kind of like, okay. So for anyone like me that wants to look, really soon, I'm just going to tell you that it gets so much better. How you wake up and how you look is not how you're going to end up. Look at the pictures. But the staff was fantastic. They make sure that your pain's manageable. You sit up the next day and then you go walking, and that really didn't bother me. I call it my metal boyfriend. I would take the IV pole and walk around, and it actually felt really good to get up. I mean, you're really tight in your stomach. Then I went, being out of state, went to the hotel room, stayed there for a couple of weeks, went home and went right back to work, and it's only gotten better and better and better. So, the shape, I was surprised at how pretty the shape is. I had, when Dr. C went in and rebuilt my left breast, he also did the mastectomy on the right. And so tomorrow is my second surgery for the contouring and the smoothing, and to be honest with you, I think it's going to end up looking just fantastic, really. So I don't care if he would have been 5 states away. I would have driven, flown, been on the Greyhound bus, whatever, get on the party barge, whatever, I would have come and had Dr. C do this, because the staff and Dr. C, you can tell that they care about you. I remember him just sitting and talking with me at pre-op, and I was like so nervous. And he's just got a very easygoing personality, and it puts you at ease. And I thought I was going to have to lose my right nipple. And he said, well, do you want to keep your nipple? And I thought, well, isn't it easier for you if I don't? He said, it's not about me, it's about you. We're going to keep it. And sorry.
Okay.
I remember thinking, I get to keep a part of being a woman. I get to keep part of me. Cancer didn't take that part. And so I was so excited that I got to keep that, because I thought both of them were going to be gone. And while it's a small thing, it's a big thing for a woman. So you go in for the surgery, and it's 7 hours. And when you come out, like I said, I looked down and I thought, oh, it's me. And it looks good. It really does. So, all I can say is, if anyone, if you are newly diagnosed, it's a horrible diagnosis to have. Your life stops for a moment, but it picks back up. You can get through it. You can get through chemotherapy. You can get through radiation. You can get through a mastectomy. You are stronger than you know. You will find a strength that you didn't know that you had. That same steel in your backbone that you have to call on every single time you sit down for chemotherapy, and allow them to do that to your body, is the same strength that will take you forward. Coming here is probably one of the easiest choices you'll ever make. It will be the best choice that you can make. You will not be disappointed. You have earned the best. You deserve the best, and you'll get the best by coming to PRMA, and I believe that wholeheartedly. And if I got the diagnosis again, I would not change this decision, other than to make it sooner. I would have looked for PRMA. Being out of state is not even a consideration in coming here. It is so well orchestrated. It is, we're taken care of. It is so easy. It's like going to your doctor in your own home state. It's that easy. And I just think that anyone that has had a cancer diagnosis deserves the best and should settle for nothing less. They don't have to go to someone that they feel it may be easier for them because it's down the street. This is just as easy. Absolutely just as easy, and there are resources to help people get here. And they deserve it after everything that they've gone through. So I would do it again.